Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. This episode, our focus is on pain management, and joining me is Dr. Daniel Reynolds, diplomat of the American Board of Anesthesiology. Thank you for being here.
Thank you for having me.
Your specialty is actually in pain management, so what type of patients would seek, aside from having the pain, but what type of disease processes do you see in your practice?
The primary reason for presenting to a pain management physician is usually chronic low back pain. Probably 80 to 90% of the patients I see, that will be their chief complaint. But it's far from being the only thing that we treat in a chronic pain management setting. Chronic neck pain, cancer pain, and specialized kinds of pain such as sympathetically maintained pain, also known as chronic regional pain syndromes, are common presentations.
Now I'm hearing you use the term, and I know our viewers at home have heard the term too, chronic and acute pain. Mm-hmm. What is the difference between the two?
Acute pain is essentially any kind of pain that you feel following any kind of injury, operation, illness, what have you. Really the difference between the two is that acute pain generally lasts days, weeks, at worst a couple of months, whereas chronic pain by definition is pain persisting beyond what should be a time to heal completely. As a general rule of thumb, we regard any pain that persists for more than 6 months as chronic pain.
Now, a person then, they could come to you, and seek pain management with either the acute or the chronic, but generally it's more the chronic pain, I would assume. Is that correct? Right. Now, when they're coming, what would be some tips for the patient to be prepared so that you can help and they can partner with the physician with the pain management?
The best thing a patient can be prepared to do is describe the pain that they're enduring as completely as possible. Both in terms of severity, location, duration, as well as characterizing it in ways such as burning, shooting, stabbing, aching, throbbing. All of these kinds of things help hone in on what the underlying problem may be.
And maybe even what triggers the pain.
That's right.
And sometimes maybe movement, or if they're laying down or standing, sitting, those types of things too.
Absolutely.
So it really is a partnership so that you can help control and manage that pain. I know when we think of pain management, we think medication. What is beyond the pill, the types of medications that are out there in pain management for these types of individuals?
A lot of what I do is procedure-based approaches to help control pain specifically. With few exceptions, most of the procedure options that I have to offer don't alter the underlying process causing the pain, but instead the symptom of the pain itself. The most common procedures are steroid injections, whether epidural or injections to various joints in the body. More highly specialized procedures exist for patients who don't do well with steroid injections alone. These include things such as ablation of nerves that mediate pain to the specifically affected parts of the body, as well as things such as spinal cord stimulation.
Is there something called a TENS unit? Can you explain that to us?
A TENS unit is transcutaneous electrical nerve stimulation. There's an underlying theory to the physiology and treatment of pain called the gate theory of pain. That was first presented approximately 50 years ago, but only over the past 20 to 25 years has really gained traction in the medical community. And what this means is within a nerve there are several different types of fibers that carry several different types of sensation, pain being one of them, but among others are things such as vibration, position, things of this nature. And what we have found is that the fibers that carry pain are very, very small by comparison to the fibers that carry these other kinds of sensation. And essentially, if we stimulate these larger fibers, specifically ones that carry vibration, that sensation tends to get transmitted to the brain and crowd out the pain sensation. So a TENS unit is applied to a painful body part to create this kind of buzzing sensation in the hopes of crowding out the painful sensation. It's also the basis for spinal cord stimulation, as I mentioned before, which is a much more invasive process. And as I said, it's an emerging technique over the past several decades. But although previously the understanding wasn't there, as it is in modern times, similar ideas have persisted as far back as ancient Greece, where electrical eels were applied to people's skin to function in the same way that a TENS unit would today.
I'm glad we're not using eels anymore.
So am I.
That would be a little difficult in our lifestyle.
It's a bit primitive.
It is.
But it's a tried and true approach.
Well, when you're in pain, and everybody has suffered pain at some point, whether it be acute or chronic, and that chronic is the nagging and the going on, and it really can disturb an individual's quality of life. So they're trying to partner with you and have that opportunity so they can get back to their daily activities and their lifestyle. So I'm sure part of pain management too is looking at how they can meet those expectations and work together to keep it under control.
Absolutely. Importantly, as I mentioned, a lot of what I do is symptom management, with the goal that once someone's pain is better controlled, a patient would have the opportunity to become more active, whether that's to improve weight control, to improve flexibility, improve range of motion, what have you. Ultimately, those are the things which will keep pain at bay. So essentially my goal is to empower a patient with the ability to improve upon their lifestyle and ultimately improve their total pain control down the road.
And their quality of life,
Absolutely.
Now, a lot of the patients that you see, I know you mentioned chronic back pain, and that tends to be the #1 complaint.
That's right.
And #1 reason I think that individuals, aside from the common cold, miss work.
Absolutely.
And we understand that a lot of us suffer from back pain. So they may be doing some other things in working with their primary care physician. Do they need a referral to see someone in pain management?
We require a referral from a patient's primary physician or another provider, whether that's a surgeon or another physician in the community that is familiar with the patient. In large part because there are only so many slots available in a pain clinic, and we need to help the most severely affected people, I think, first.
So the individual who has the pain is working with their, again, primary physician, maybe their surgeon or someone, to work on what really is causing the pain. It could be, like you said, cancer or something along those lines too. So they're actually working on treating that. You really are working on the symptom as far as the pain and making sure that they can have that taken care of.
That's right.
How long generally does a person go through a pain management program?
Usually our goal is to get a patient to where they've achieved what we call maximal medical benefit. It's hard to put a time frame on that. If we can really improve a patient's state within a few weeks, and then they don't require to follow up and see me on a routine basis, that's great. If someone has a more persistent problem that we elect to treat with medication, then we'll work with that until we get to a steady state, improve as much as we can, and don't seem to be changing our regimen of treatment. And then beyond that, there's no need to follow up with me just to have medication refills for a long period of time.
So basically, when a person is seeking that pain management, they need to come and have the list of maybe the triggers, the type of pain, the sharp, the dull, the stabbing that you were talking about too, the location, and probably a list of medications that they may have already tried. Can you tell us a little bit about mixing maybe non-prescriptive medications with prescriptions? Is that doable or something you discuss? If they're taking a prescribed medication and then think they might be able to take something over the counter on top of it?
Sure. It's important to discuss whether to add on over-the-counter medications, not just with a pain management physician, but with anyone who's managing your medications. For example, we often regard over-the-counter Tylenol as a very mild, non-threatening medication, and it is an outstanding pain reliever, which is why it's also featured in a lot of prescription combination medications. And a patient may not be aware that a medication that they're being prescribed contains Tylenol or acetaminophen, and inadvertently supplement additional over-the-counter acetaminophen into a total dosage range that's not advisable and can be threatening. For these reasons, using that as an example, it's important to discuss the use of over-the-counter medications, herbal medications, and all of these things with your physician.
Right, and your pharmacist is a good reference too.
Absolutely.
But really make sure that you know what you're taking, and only take your prescribed medications, and never share when somebody else in the family says they might have pain or this or that. It is specifically just for you.
That's absolutely true.
And we cannot put that at home enough, right?
That's right.
Send that
we can't
home.
emphasize that strongly enough.
It's very important. Dr. Reynolds, I know you see the patients in your office, but are procedures actually performed in the office, or are they on an outpatient basis?
The only procedure that I perform in the office is a simple trigger point injection, if indicated, injections to painful muscles, that is. Essentially, all of the procedures that I perform otherwise are done within the hospital, in the radiology, or actually the vascular suite, where they have space available for me, under X-ray guidance. I don't have the opportunity to perform those in our office. It's not equipped with X-ray. But almost every procedure that we perform is done on an outpatient basis. Occasionally we'll provide some IV sedation for patients.
I would assume the X-ray actually helps for specific location in getting the pain, correct?
That's right.
Localizing
it helps
the
us
pain
really
to that area.
hone in on the source of the pain. One or two procedures that I perform are done in the outpatient surgery center within the Hard Memorial Hospital setting. But those, again, are outpatient procedures and require a brief monitoring period following the procedure, after which the patient goes home with family.
And then hopefully would assume, when they have those procedures, is there a period of time that they might expect to start feeling better? Or does it, I know it is based upon the patient and what type of pain that they're having, but generally is there a time that they might expect within 3 to 5 days or something along those lines?
Yeah, that's a good question. I'm glad you asked, because often we forget to mention that. If we're doing a steroid injection, it takes 2 to 3 days before those effects of that medication become prominent. And considering that we've performed a procedure, it's a shot, there's a needle, often day of, maybe day after, the patient will be quite sore.
At the point of injection.
Exactly. So without that prior knowledge that it can take a few days before the effects of the injection become apparent, it can be rather frustrating if a patient feels worse for the first couple of days than they did before they came in. But it's par for the course. Any injection site is going to be tender for a day or two, after which the medication should kick in.
And you know, that is important, because the person seeking that pain management is expecting hopefully some instantaneous, relief.
Right.
And they have to understand that they have to take steps in order to get to that point and achieve it.
Crawl before we walk, so to speak.
We so appreciate you sharing this information with our viewers today, and hope if they have any questions that they'll go to the website and look for your information. Thank you for being here.
Thank you for having me.
For more information on pain management, or to find a physician and seek Dr. Reynolds' assistance, www.hmh.net, our website. For other information, American Chronic Pain Association at P.O. Box 850, Rockland, California, 95677, or www.theacpa.org, or the American Pain Society at 4700 West Lake Avenue, Glenview, Illinois. Their website is www.ampainsoc.org. Thank you again for joining us this episode, and we hope you tune in next month for another edition of Health in the Heartland.